Top 20 HIPAA Compliance Interview Questions and Answers. HIPAA compliance is essential in maintaining patient privacy and protecting sensitive health information. These top 20 HIPAA compliance interview questions and answers help candidates prepare effectively. 1. What is HIPAA and why is it important? HIPAA, or the Health Insurance Portability and Accountability Act, establishes national standards for protecting sensitive patient information. It ensures privacy, security, and confidentiality of healthcare data. HIPAA is important because it safeguards patient trust, prevents misuse of data, and ensures organizations follow ethical and legal obligations when handling protected health information, PHI. Compliance also reduces risks of data breaches, penalties, and reputational damage while promoting responsible healthcare practices. 2. What are the key components of HIPAA? HIPAA has several key components: the Privacy Rule, Security Rule, and Breach Notification Rule. The Privacy Rule protects patient rights regarding FI access and disclosure. The Security Rule requires administrative, physical, and technical safeguards for electronic FI, ePHI. The Breach Notification Rule mandates that organizations notify affected individuals and authorities when PHI is compromised. Together, these components ensure comprehensive protection, accountability, and transparency in healthcare data management and compliance operations across all covered entities and business associates. 3. What is Protected Health Information, PHI? Protected Health Information, PHI, includes any identifiable health information related to a patient's condition, treatment, or payment that is stored or transmitted electronically, verbally, or on paper. Examples include names, addresses, phone numbers, medical records, and insurance details. PHI must always be safeguarded to prevent unauthorized access or disclosure. HIPAA requires organizations to implement strong privacy and security measures to ensure that PHI remains confidential, accurate, and available only to authorized individuals for legitimate healthcare purposes. 4. Who must comply with HIPAA regulations? HIPAA regulations apply to covered entities and business associates. Covered entities include healthcare providers, health plans, and healthcare clearinghouses. Business associates are third parties that handle PHI on behalf of covered entities, such as billing companies or IT vendors. Both groups are responsible for implementing HIPAA-compliant safeguards and training staff to protect patient information. Non-compliance can result in severe financial penalties, legal actions, and damage to professional reputation, making adherence to HIPAA standards a mandatory requirement for all. 5. What is the HIPAA Privacy Rule? The HIPAA Privacy Rule sets national standards for the protection of individually identifiable health information. It governs how PHI can be used and disclosed by healthcare organizations and their partners. The rule ensures that patients have rights to access, correct, and control their information. It also restricts disclosures without patient consent except for necessary purposes like treatment, payment, or healthcare operations. Compliance with the privacy rule builds patient trust and ensures proper data handling practices across healthcare settings. 6. What is the HIPAA Security Rule? The HIPAA Security Rule focuses on safeguarding electronic protected health information, ePHI. It requires covered entities to implement administrative, physical, and technical safeguards to ensure confidentiality, integrity, and availability of ePHI. Administrative safeguards include risk assessments and workforce training. Physical safeguards involve controlling facility access, while technical safeguards protect data through encryption and secure access controls. Compliance helps prevent unauthorized access, cyber threats, and data breaches, ensuring patient information remains secure in digital healthcare environments. 7. What is the HIPAA Breach Notification Rule? The HIPAA Breach Notification Rule requires covered entities and business associates to notify affected individuals, the U.S. Department of Health and Human Services, HHS, and sometimes the media, in case of a data breach involving FI. Notifications must be issued without unreasonable delay, usually within 60 days. The rule promotes transparency and accountability in healthcare data protection. Timely reporting allows affected individuals to take protective steps against identity theft or other potential misuse of their sensitive health data. 8. What are common examples of HIPAA violations? Common HIPAA violations include unauthorized access to FI, sharing information without patient consent, lost or stolen devices containing unencrypted FI, and failing to conduct regular risk assessments. Other examples include improper disposal of medical records, inadequate employee training, or discussing patient details publicly. Such violations can result in severe civil or criminal penalties. Maintaining compliance requires strong security protocols, continuous monitoring, and staff education to prevent unintentional or malicious exposure of sensitive healthcare information to unauthorized parties. 9. How should HIPAA be disposed of securely? HIPAA should be disposed of securely through shredding, pulping, burning, or using certified destruction services for physical records. Electronic HIPAA must be permanently deleted using data wiping or degaussing methods to prevent recovery. HIPAA mandates covered entities to follow strict disposal policies to protect against unauthorized access after disposal. Maintaining records of destroyed materials and training employees in proper procedures helps ensure ongoing compliance. Secure disposal safeguards patient privacy and reduces the risk of data breaches or misuse. 10. What is a Business Associate Agreement, BAA? A Business Associate Agreement, BAA, is a legally binding document between a covered entity and a business associate. It outlines the responsibilities and obligations for handling HIPAA in compliance with HIPAA. The BAA specifies permitted uses, safeguards, reporting procedures, and termination conditions. This agreement ensures accountability and clarifies the legal boundaries for third-party data access. Without a valid BAA, both parties may face penalties. BAAs are crucial for maintaining trust and protecting patient information throughout healthcare partnerships. 11. What should you do if you suspect a HIPAA violation? If you suspect a HIPAA violation, immediately report it to your compliance officer or supervisor. Documentation of the incident and relevant evidence is crucial. The organization must investigate promptly and take corrective actions if necessary. Depending on severity, the incident may need to be reported to the Department of Health and Human Services, HHS. Reporting violations early helps prevent further breaches, reduces legal consequences, and demonstrates a strong ethical commitment to maintaining patient privacy and organizational integrity. 12. How often should HIPAA training be conducted? HIPAA training should be conducted upon hiring and refreshed annually or whenever regulatory updates occur. Regular training ensures employees understand privacy policies, recognize potential risks, and follow compliance procedures effectively. It also reinforces accountability and awareness across the organization. Training should cover the privacy, security, and breach notification rules, including real-life examples. Documentation of training sessions is essential for audit purposes. Continuous education helps reduce human error, ensuring that all staff handle HIPAA responsibly and securely. 13. What are administrative safeguards under HIPAA? Administrative safeguards are policies and procedures designed to manage the selection, development, and maintenance of security measures protecting HIPAA. They include risk assessments, workforce training, access control, and incident response planning. These safeguards ensure that management practices align with HIPAA compliance standards. Effective administrative safeguards also include appointing a privacy officer, regularly reviewing policies, and ensuring vendors comply with HIPAA requirements. Implementing these measures promotes a proactive approach to data protection and minimizes the likelihood of violations. 14. What are technical safeguards under HIPAA? Technical safeguards focus on technology and the policies governing its use to protect HIPAA. They include access control mechanisms, encryption, audit controls, and automatic logoff systems. Encryption ensures data security during transmission and storage, while access controls limit HIPAA to authorized personnel only. Regular monitoring and system audits help detect suspicious activity or potential breaches. Implementing robust technical safeguards ensures compliance with the HIPAA security rule and strengthens data integrity and confidentiality across healthcare systems and electronic platforms. 15. What are physical safeguards under HIPAA? Physical safeguards protect electronic systems and related facilities from unauthorized physical access or damage. They include secured facility access, workstation use policies, and device and media controls. Examples include keycard entry systems, locked file rooms, and secure disposal of electronic devices. These safeguards prevent theft, tampering, or accidental exposure of HIPAA. HIPAA requires organizations to establish clear physical security measures to maintain data protection and ensure only authorized personnel can access sensitive patient information in healthcare environments. 16. What happens if an organization fails to comply with HIPAA? Failure to comply with HIPAA can result in severe consequences, including hefty fines, criminal charges, and reputational damage. Civil penalties range from hundreds to millions of dollars, depending on the severity and intent. Repeated or willful violations may lead to imprisonment. Non-compliance can also lead to loss of patient trust and business opportunities. Implementing corrective actions, regular audits, and comprehensive employee training are crucial for preventing violations and ensuring continued adherence to all HIPAA compliance requirements. 17. How can organizations prevent HIPAA breaches? Organizations can prevent HIPAA breaches by implementing robust security measures such as encryption, access controls, and regular audits. Conducting risk assessments and continuous staff training are equally essential. Strong password policies, secure data transmission, and timely software updates also reduce vulnerabilities. Additionally, enforcing strict privacy policies and monitoring system activities help detect potential breaches early. Creating a culture of compliance and accountability across all departments ensures that FI remains protected and handled ethically at all times. 18. What should a breach response plan include? A breach response plan should include procedures for identifying, containing, and investigating the breach. It must outline communication steps for notifying affected individuals, the Department of Health and Human Services, HHS, and other relevant parties. Documentation and post-incident evaluation are vital to improve future prevention efforts. The plan should assign roles, responsibilities, and timelines for each stage of response. Regular testing and staff training ensure the organization responds effectively, minimizing damage and ensuring HIPAA compliance during emergencies. 19. How does HIPAA affect electronic health records, EHR? HIPAA directly impacts electronic health records, EHR, by requiring secure storage, access, and transmission of patient data. The security rule mandates encryption, access control, and audit tracking within EHR systems. Providers must ensure that only authorized users access patient information and that data integrity is maintained. Proper implementation of security features reduces the risk of data breaches. HIPAA compliance in EHR systems promotes accuracy, efficiency, and patient confidence in the digital management of healthcare information. 20. Why is continuous monitoring important in HIPAA compliance? Continuous monitoring is vital because it helps detect, report, and mitigate potential security threats before they escalate. It ensures systems remain compliant with evolving HIPAA requirements. Monitoring involves reviewing audit logs, user access, and security alerts regularly. By maintaining constant oversight, organizations can identify unusual activities and address vulnerabilities promptly. Continuous monitoring fosters a proactive compliance culture, protects sensitive data, and helps maintain trust between patients, healthcare providers, and associated business entities handling FI responsibly. Preparing for HIPAA compliance interviews requires deep understanding of privacy, security, and ethical standards. Mastering these questions ensures readiness to protect patient information and uphold healthcare integrity.